If you have Crohn's disease or ulcerative colitis, I understand exactly the one thing that you want, a control. After years of having multiple episode of flares and uncertainty with endless amount of random advice online, the carnivore diet looked like a simple answer. It is simple and it feels quite decisive, and the internet is full of dramatic stories of people saying that they've never felt better before and even stopped their medications altogether. But as someone who spent my entire career treating and researching inflammatory bowel disease, I can tell you that feeling better doesn't always necessarily mean your gut is also better. Hi, if we haven't met, I'm Dr. Ryan Choi, a gastroenterologist and a PhD scientist based in Sydney, Australia. I've treated hundreds of patients with Crohn's disease and ulcerative colitis throughout my career, and I've spent years researching how the inflammation impacts your bowel in molecular and genetics level. So that gives me a unique perspective to separate what's truly evidence-based from what's just maybe a trend. So in this video, I'll break down what the evidence actually says and what are the facts, what are the hypes, so that you can make a safe and informed decision about your diet. So let's talk about carnivore diet in inflammatory bowel disease. So that is Crohn's disease and ulcerative colitis. And I do hope that you find this talk useful. So this talk is divided into 3 parts. So I'll start off the presentation by stating what carnivore diet is. And secondly, I'll touch on the evidence for and against the carnivore diet. And I'll conclude this presentation with my take on the carnivore diet in patients with ulcerative colitis and Crohn's disease, and importantly, what I tell my patients. So stay focused. The carnivore diet is a form of elimination diet where you're only allowed to have animal-based food. So that includes meat and animal fats, as well as fish and seafood. And importantly, it excludes vegetables and fruits. So why do people like carnivore diet? That is because it is quite simple. Unlike some of the other diets that is commonly used in inflammatory bowel disease, such as Crohn's disease exclusion diet or EEN, exclusive entry nutrition, as I discussed in my other videos. And in comparison, carnivore diet is very simple because it's simply all meats and nothing else. And importantly, it also eliminates a common trigger foods. So that includes things like high fiber and gluten. And if you have inflammatory bowel disease, you'll probably know that when you have active disease or bad flare, high fiber based food or gluten doesn't go very well. So because the carnivore diet excludes these high fiber stuff and gluten and other common triggers, I think a lot of patients reports that they do feel better with carnivore diet, which lead them to believe that carnivore diet is actually healing their inflammatory bowel disease. And I think this is why it creates such a strong positive feedback in an internet, with a lot of patients and people suffering from inflammatory bowel disease swear by having carnivore diet, how it improves their symptoms. But this is all good, but the real question is, does carnivore diet actually improve the inflammatory bowel disease? Does it actually work in terms of healing, which is the main outcome we're trying to achieve in patients with inflammatory bowel disease? So let's now touch on the evidence for and against carnivore diet in inflammatory bowel disease. And before we start, I want to explain something really important: the idea of evidence-based medicine and different level of evidence. It is so important because there's billions of studies and the research findings from the scientific community, but they don't all come in the same quality. And some of the studies are very high level, whereas some of the other studies are very low level evidence, and which should be taken as a grain of salt. For example, if you go all the way down to level 5, which is the lowest level evidence possible, these are largely formed of things like case report, which is based on 1 or 2 patients, or expert opinion based on their previous experience. So these are very useful in generating future research ideas to test it out properly, but level 5 evidence on its own is not really demonstrate a causality. But as you move up the level of evidence, the quality of studies goes up. So for example, level 1 or 2 evidence typically involves multiple studies, including thousands of patients, and looking at rigorous analysis. So we know that it's much more accurate. So everything we do in healthcare, every test and treatment or diet we recommend should be based on the evidence, not just the opinion based on the stories and what you hear online. And that is because you're dealing with someone's health and sometimes even their life. So think about it this way. If your loved one or the family member was sick and you were trying to find the best solution for that, would you rather rely on a one person's story from social media or data gathered from rigorous studies based on thousands of patients, carefully studied by the scientists? And I think it is obvious that the answer is latter, and is basically very simple math. And more data we have, more confident we can be that of something truly works and is safe. That's why doctors like myself, clinicians, always ask when someone claims about anything, what is the evidence behind it? And it's not that we dismiss people's experiences, but those stories can be, as I said, is very helpful, strong starting points. But we always need to check whether they hold up when tested on a larger scale with higher number of patients. So as we go through the talk, it is very important to keep this in mind because it will help you in terms of how you interpret the medical evidence, which is important because you want to do the right thing for your body and your friends and your loved ones. I hope that makes all sense. So now that said, let's have a look at the evidence for the carnivore diet in patients with inflammatory bowel disease. Unfortunately, to date, there are no large-scale studies or randomized controlled trials supporting the use of carnivore diet in patients with Crohn's disease or ulcerative colitis, either as an induction regime or the maintenance regime. So at the moment, the evidence is all based on patient anecdotes or case reports, which, as I explained earlier, lowest quality evidence. So keep that in mind when we review this evidence. So this is an important and an interesting study, which certainly generates a hypothesis and based on 10 patients with inflammatory bowel disease, where all of these 10 patients were recruited by a single author based on his prior contacts or via social media advertisement. And authors then performed a detailed interview to gather patients' first-hand experience with carnivore diet, mainly based on their symptoms. And this table shows the main summary of the results. It's a very busy table, but if I could get you to focus on the right aspect of the table, highlighted in red box here, and where authors used a quality of life index called Inflammatory Bowel Disease Q questionnaire, or called IBDQ, that is designed to assess patients' bowel symptoms and other systemic symptoms such as lethargy, as well as the emotional and social impact, which is of course very important. And just to give you an idea, the score of the IBDQ ranges from 32, which is the lowest, which means that you feel the most terrible ever, all the way up to 224, where you're feeling completely the best. And as you can see from this table here, all of the 10 patients studied reported remarkable improvement in inflammatory bowel disease questionnaire score after carnivore diet, with IBDQ score increasing by 121 on average, which was a substantial finding. But what are the caveats and limitation of the study? I think one of the important limitations of this study is firstly selection bias. So what this means is that the authors recruited people through social media. So the study naturally attracted those who felt that they would benefit from the carnivore diet. Whereas people who tried it before and no big improvement, they're probably unlikely to respond to such survey. That probably already tilts the results towards positive outcomes. So that's what we call selection bias, which I think is very relevant in this study. And secondly, the assessment of the disease activity was largely based on patient symptoms, with only a few out of the 10 reporting objective markers such as calprotectin, which is an inflammation score based on the stool test. And thirdly, the study wasn't really controlled. That means that other factors that could easily explain the improvements of patient symptoms. For example, some patients were changing medication at the same time, so this can all impact on the results, and these were not adequately controlled for. So when we put all that together, we can't confidently say, based on this study, that the carnivore diet caused the improvement in these patients. And it could just be the medication changes or natural ups and downs of the disease, which is the nature of the Crohn's disease and ulcerative colitis, that could have led to the results. And the other important thing is the follow-up. Looking at this paper, a few patients reported feeling well for up to about 18 months, for example. But anyone who looked after inflammatory bowel disease patient long enough will probably know that we all had patients where they felt fine, they stopped the medication and gone away, didn't come to the clinic for several years and come back with really nasty complications such as strictures and fistulizing Crohn's disease. And that's one of our most dreaded outcomes, and we actively try to prevent those kind of situations. So while this paper is interesting and even encouraging in some aspect, we have to interpret it carefully and we have to take it as grain of salt. So definitely is an important observation, but not a solid proof, not a green light to my mind. Let's look at the other study. This is another case report based on a single patient. So it's actually lower quality than the earlier study, who I think was about 16-year-old who went on ketogenic diet after trialing multiple lines of different medication for Crohn's disease without success. And subsequently, patient was advised to go on the ketogenic diet, which was formed of animal fats, meat, and offal and egg. And then they assessed the outcome based on symptoms and blood tests and radiological markers. So this is the results. The authors reported patient has significant improvement in energy level and physical fitness and had increased in weight by 9 kilograms, as well as improving blood test markers, as well as radiological appearance, which is quite encouraging. Now, of course, the devils are in the detail, and have a look at this graph, which was actually in the paper. And if you look on the top, this bar indicates kind of medications that patient had been on during that time. All this reported significant improvement in CRP and ESR, which are the blood markers for inflammation. And you can see the trend of CRP in blue and trend of ESR on red. And if you look at the graph carefully, as I marked in the black box here, you can see that the majority of the improvement of the CRP and ESR has actually happened when patient was taking the drug therapy, even before starting the carnivore diet. So it is not entirely correct to say that the carnivore diet has actually improved these blood markers, and probably it was the medications or something else. So overall, at present, although these small studies shed some hope in carnivore diet in people with inflammatory bowel disease, at present, the evidence and data backing this up is very limited, with lowest quality evidence at level 5. Now let's move on to the evidence that does not support the carnivore diet in patients with inflammatory bowel disease. The evidence against the carnivore diet is also not perfect either. So at the moment, there are no randomized controlled trials or RCTs demonstrating the harm of carnivore diet in inflammatory bowel disease. There are, however, some moderate quality indirect evidence from a variety of different studies that looked at diet related to carnivore. Now, this is an important paper that was published in Journal of Crohn's Colitis, which is a main journal for one of the biggest society in inflammatory bowel disease called European Crohn's Colitis Organization, or ECHO. So scientists actually have looked at the impact of carnivore diet in the risk of development of Crohn's disease or ulcerative colitis in large population cohort. So this paper was published in 2022. This was a population-based cohort study looking at more than 120,000 adults. They studied each individual using a detailed dietary questionnaire at the baseline and followed up after 14 years on average, which is massive. And they looked at dietary patterns associated with inflammatory bowel disease development. And this is the results. It's quite a complicated table, but essentially the numbers that you're interested in is odds ratio and the p-value. So what odds ratio tells you is the percentage increase in risk of developing something. In this case, is Crohn's disease. So what the scientists looked at for this study is that they identified a dietary pattern 2, which consisted of high intake of snacks and prepared meals, non-alcoholic beverages, low intake of fruit and veg. These dietary pattern was associated with at least 16% risk of developing Crohn's disease if you didn't have Crohn's disease before. And the next number that you're interested is a p-value. So if the p-value is less than 0.05, that means it's statistically significant, meaning that observation has not occurred by chance and is a true genuine association. It's not entirely carnivore diet, but the fact that you have low intake of fruit and veg was associated with developing Crohn's disease, which goes against suggesting carnivore diet for someone with Crohn's disease for that reason. Now let's have a look at what were the dietary pattern associated with increased risk of developing ulcerative colitis. The scientists found that it was dietary pattern 3. Dietary pattern 3 means that these individuals had high intake of red meats and poultry and processed meat, which essentially is very similar to carnivore diet. And compare with those who were not on dietary pattern 3, they had approximately 11% increased risk of developing ulcerative colitis, which was also statistically significant. So, summary from this study was that it implies that the dietary pattern similar to carnivore diet is associated with onset of ulcerative colitis and perhaps Crohn's disease by the virtue of not having enough vegetable and fruits in their diet. And obviously, this raises concern over excessive carnivore diet in inflammatory bowel disease patients. And of course, this study is not perfect. The strength is that it's a massive scale study with more than 120,000 adults. And it was a prospective study, which means that there's no recall bias. And the long follow-up time and validated dietary assessment was the strength of the study. However, this was mainly observational study, so it proves the association, but it's not a causation, and it's not entirely specific to the carnivore diet. That brings me on to the next important study. Now, this was a prospective cohort study looking at 191 ulcerative colitis patients who have followed up for about 12 months, and the authors investigated the effect of habitual diet on the risk of relapse or flare. So these were patients who had ulcerative colitis already, but they looked at the impact of certain diet in terms of developing risk of relapse or becoming active disease again. This is a very crowded table, but essentially the numbers you want to look at is again odds ratio, which dictates the risk of developing relapse or active disease. What this table tells you is the association of dietary intake of certain food groups and relapse in ulcerative colitis. And what I want you to focus on is this red box here. And as you can see, the meat and the meat products, especially red and processed food, increase the risk of having a flare, as evidenced by having an odds ratio of 1.37, which indicates that there's a 37% increased risk of developing ulcerative colitis flare compared with those who are not. And importantly, the effect was proportional. So if you were having a medium amount of red and processed meat intake, your odds ratio of developing active disease was 2.16, which means you had more than twice the risk of developing active disease. But what is more important and striking that if you are having a high amount of intake of red and processed meat, your risk goes up even higher to more than 5-fold compared with those who didn't, which indicates that the risk of developing a flare in patients with ulcerative colitis was proportional to the absolute amount of the meat and red meat consumed, which indicates the fact that it is important to moderate red and processed meat intake as much as possible to keep you out of the active disease. So in summary, this table demonstrates that excessive carnivore diet may increase the risk of developing a flare or active disease if you have ulcerative colitis. And the table clearly demonstrates the risk is proportional to the absolute amount of the meat or red meat consumed. So I just wanted to highlight the fact that one of the biggest fear and the worst complication you can have if you have inflammatory bowel disease, of course, is cancer, specifically colorectal cancer. Why am I bringing this up? The reason that I'm bringing up this important message is that because there was this important and very well-known and massive scale study demonstrating the impact of certain diet in development of colorectal cancer. This study was based on UK Biobank, which was a massive, again, population study involving more than 450,000 adults in United Kingdom, followed for a long time, over almost 6 years. And they correlated dietary factors associated with development of colorectal cancer, i.e. the cancer of the large bowel. So what did they find? We'll go straight into the results. So in this case, the way that you interpret this table is that hazard ratio, or HR, is very similar to the odds ratio. The number essentially gives you a percentage increase of risk of an outcome, in which case is colorectal cancer. So what this forest plot shows you is that there's a strong positive correlation between the amount of the red and processed meat consumed and the risk of developing colorectal cancer. Specifically, the investigators found that having a red and processed meat 2 to 3 times per week showed a trend towards development of cancer, which was not statistically significant. But if you have red or processed meat 4 times per week or more, there was approximately 20% increased risk of developing colorectal cancer. And of course, this is very important finding, and it should highlight the fact that excessive consumption of carnivore diet, especially red and processed meat, should probably be done carefully because of the concern of developing colorectal cancer. That was an important study because we know that patients with inflammatory bowel disease already have a significant risk of developing colorectal cancer compared with people without the inflammatory bowel disease. So this is an important study that I performed with a group of my colleagues when I was back in the United Kingdom, looking at one of the biggest bowel cancer screening program in the world for patients with inflammatory bowel disease. And this is what we call a Kaplan-Meier plot, showing the risk of precancerous lesion called dysplasia or cancer in the colon over time in patients with ulcerative colitis. And our data showed that by the time you had 20 years of inflammatory bowel disease, you already have more than 14% risk of developing precancerous lesion or cancer itself. So you don't want to be doing anything to exacerbate already increased bowel cancer risk. So overall, so far we looked at the evidence against the carnivore diet, but again, what's the quality of evidence? So evidence is still not perfect because these are not like entirely dedicated studies just for the carnivore diet. But I'll say the quality of evidence lies somewhere between level 3 and probably level 2, but we're still not quite there. So let's now move on to the conclusion. So in summary, I think the carnivore diet does provide to some extent symptomatic benefit in some patients, But evidence is very limited and is of low quality. And we do have an alternative explanation as to why the carnivore diet may help with your symptoms. That's because it doesn't have any fiber, gluten, and other irritants that commonly irritate your gut when you have active disease, rather than the carnivore diet per se. I've also demonstrated that the carnivore diet may have a significant risk, especially the red and processed meat, especially when you have excessive consumption of meat-only diet, which may be associated with increased risk of flare in ulcerative colitis patients and higher risk of developing bowel cancer, which is something that we want to avoid. So what do I tell my patient? I tell them three things. Firstly, I tell them to try and understand the benefit and risk. And there's no sort of single diet that fits everyone. Everyone's body responds differently. And I'll say you have to weigh the benefit of having a symptomatic improvement with the risk associated with carnivore diet long term, such as increased risk of flare in ulcerative colitis, and of course the bowel cancer. Secondly, if you do feel symptomatic relief with carnivore diet, I think for short term it's probably okay, and it's largely evidence-free zone. We don't have any studies demonstrating the benefit or the adverse events of the short-term use of carnivore diet. And we all had a period where we go off on holiday, have just barbecue every day, we're okay. So for short-term stuff, it's probably okay. But you need to think about it carefully before committing yourself to long-term carnivore-based diet. I think it's important to stay safe and maybe consider safer alternative. So for example, if you're going to have a lot of meat, avoid processed meat and have red meat in moderation. Just have it once or twice a week, but not every day, for example. And chicken and fish and eggs are probably less harmful. And make sure that you include fruit and veg into your diet, especially if you like them. And thirdly, this is so important. Please don't stop your medication, even if you feel better with carnivore diet. And this is where bad things happen. And I'm sure other inflammatory bowel disease doctors will agree that we all have patients where they change their diet and go away and stop their medication, don't come back for years and years, and they come back with massive complication. And by then it is a lot more complicated to get the disease back under control. So please, please, please do not stop your medication. And lastly, it is important to remember that the symptom does not always correlate with your inflammatory bowel disease activity. So make sure you keep your log of objective disease monitoring. So that is your blood test and the stool test, fecal calprotectin, as well as recommended by your doctor, the timely investigation with colonoscopy, as well as the scans to keep an eye on your disease activity, because you don't always feel the active disease, but nevertheless, they still lead to long-term complications. So that's all I have to say. I hope all that makes sense. I hope you found this talk useful. And if you want to learn more about inflammatory bowel disease, diet, and other sort of related topic, here's the link to my YouTube channel, which has several other videos like the best and the worst food when you have active flare of inflammatory bowel disease, and also have a video on steroid side effects. I go through that in detail. If you like that, and link the description below, and consider subscribing to my channel if you like the content. Importantly, stay strong. I know it's difficult and you're going through a lot of difficulty throughout your life because of this horrible disease. But I can tell you that for a lot of patients, we can get to remission, and we do have lots of patients who feel fantastic. So it is possible to get there. So please work with us. We're not like scammers. We don't try to sell drugs. Selling drug doesn't do anything for us. We just want our patients to get better, and we want our patient to avoid all the complications, so that it makes our jobs easier as well to manage well patient rather than sick patients all the time. So yeah, thank you very much and have a nice day.